I think we'll just about start. I think most people in. So good morning and good afternoon to everyone in Asia Pacific, and good evening to all those. I see a few people from the US. I'm Julian Gordon with the Linux Foundation Asia Pacific, and I'm based here in Hong Kong. And I'm excited to be here introducing this special Linux Foundation Public Health webinar. We have an amazing panel here today of public health, technology, and open source experts. They will be discussing the pressing issues facing public health authorities and their technology partners during this COVID-19 crisis, and looking beyond as well, and how the Linux Foundation Public Health Initiative is helping in this. The Linux Foundation Public Health community is actually already making a difference. It's already helping millions of people with exposure notification through open source technology and working on vaccine credentials to get the world moving again. And we are looking beyond this pandemic to how open source technology can help improve public health around the world. But before we begin, a few quick housekeeping items. Firstly, we invite you to get involved with the Linux Foundation Public Health. It would be great to see more companies and developers here in Asia Pacific join this exciting open source initiative. And there are a few easy ways to get started. You can join our Slack community, and you go to slack.lfph.io. We have channels on vaccine credentials and other areas LFPH is working on. You can go in there, join the conversations. We would love to have you and your thoughts and your conversations. We would love to have you there. You can also go to our website, lfph.io, and sign up for our newsletter to get updates on how to get involved. And in Asia Pacific, you can always approach me with any questions, and I think everyone here on this panel, anyone involved is always welcome to have conversation with anyone who wants to get involved in this open source community. Everyone is welcome. We'll put details in the chat here on how to get connected. And if you're watching this on YouTube or Tencent video later, please see in the description below, and we'll also have details how to get in touch. Now, if you have questions during the webinar, please use the Q&A function in the Zoom chat to submit them. We'll gather questions during the webinar, then we have a Q&A at the end. And with that, I'd like to ask each panelist to briefly introduce themselves and your role in this area. So I think we're going to do this in alphabetical order. So Alex, could you start by introducing yourself, please?
Sure. Hi, good morning, good afternoon, everyone. Hi, I'm Alex. I'm currently leading Tencent's healthcare business. But prior to that, I'm actually a clinician and a public health specialist. So very glad to be here. And I'm also on the board of LFPH. So hopefully we can actually drive the open source movement towards contribution to public health a lot more here in Asia Pacific.
And then I think alphabetical, it's Brian next.
Yeah, hi, Brian Behlendorf. I'm Managing Director for Blockchain, Healthcare, and Identity for the Linux Foundation, which includes a role as Executive Director on Hyperledger, but also a role as Executive Director here on LFPH, and a few other things that are brewing as well.
And then Patrick.
Hello, everybody. My name is Patrick. I'm a principal architect at the New Zealand Ministry of Health, and I was the technical lead for the New Zealand COVID Tracer app and other supporting technologies that for our COVID response in New Zealand.
Okay, thank you, Patrick. And Jenny, I say finally, but not least.
Hello, everybody. My name is Jenny Wenger. I'm the Director of Programs at the Linux Foundation Public Health. I first got involved in this by in the general pandemic response by co-founding the TCN Coalition, which was dedicated to creating an open source community around exposure notification, and have brought that and a whole bunch of other work to the Linux Foundation now. So very excited to see such a great crowd here. Thanks all for coming.
Okay, and thank you, Jenny, and thank you everybody for being here. So let's set the scene. So what is, for those who don't know, Linux Foundation Public Health, and how is it helping public health authorities fight COVID-19 and prepare, for future pandemics? So maybe Brian, would you like to start with that one?
Sure. Well, that's a very big story, and we're starting to tell more and more of it. So there's lots of that are on the LFPH website. But let me give you just a little bit of a narrative. So almost exactly 12 months ago, almost exactly a year ago, right? A lot of us started to get wind that something more serious was happening out there than we'd ever seen before in the field of pandemics. And by about March, it became pretty clear that we were going to be kind of cooped up in our homes for a while until we figured out a way out of this pandemic, or a way to not only figure out how to come up with a vaccine, how to get it deployed, also how to get society restarted again. And around that time, there were a bunch of different ways that the open source community were, people in the open source community were thinking about how they might contribute to the fight, right? I don't know epidemiology. I don't know that anyone at the Linux Foundation ever really claimed to be an expert in anything medical related, but some of us started to listen to folks talking about things like contact tracing and other kinds of apps that might be helpful here. And a lot of us were skeptical, but there are a lot of different ideas, and just no one had really tried anything at scale like this before. There's a lot of concern about how would governments use this kind of technology, and really how would the public come to trust it. So my predecessor, a man named Dan Kahn, who sadly passed away late last year, really took the charge on this, and he set aside his leadership of something called the Cloud Native Compute Foundation, which he grew to be one of the largest open source communities by any metric, and said, I'm going to figure out what we can do here. And in the course of that, understood that there was something distinct from contact tracing called exposure notification, something really focused on being a leverage point to go and figure out who might be impacted by, especially what we discovered was a major course for COVID-19, which was asymptomatic transmission, right? If you were close to somebody for 15 minutes, even if they didn't show symptoms, you might have caught something that they might have had. And so there are a bunch of people with different ideas about how to build such a system. Many of these were inferior from a privacy point of view, things like using GPS coordinates, things like, or Bluetooth in a very intrusive kind of way. But there are a group of people starting to map out, if you were to come up with a really interesting protocol for protecting privacy, but doing this at scale, how would you do this if privacy was one of your first concerns? And that's where he first met the TCN coalition, met Jenny and some of her other people who had formed around that, and said they didn't have software yet, but they had the right idea. And there were a couple of people building some implementations of that, figuring out how to make it work. But you needed access to Bluetooth Low Energy in the background. And that's where, when Google and Apple came out with the Google Apple Exposure Notification APIs, that made a lot more sense. But you still needed software. I mean, what the Linux Foundation's always been around about is open source software, and using that as a leverage point, and using that as a way to build commercial ecosystems, but also to solve a need at scale by parallelizing that effort across, as many different providers of that services, or even end user organizations who could support themselves. And we knew there were lots of governments that do know how to use open source software. We're now 15 years, 20 years past a legendary memo that the US government issued called that declared open source is as good as commercial off the shelf software, what's called COTS, right? So we knew that for this project, we should probably have some relationship with the public health authorities directly, both to help understand how the technology could work and should work, but also how they can trust it, right? And how they might be able to explain to citizens that they can trust this, that it's not going to violate their privacy or cause them to have to lock down for 2 weeks just because somebody at the other end of a football field, might have had an exposure, right? So all of that led us to first hosting a series of conversations, then identifying some software projects. A team came in with something called COVID Green that has now become deployed as the standard app for Ireland and for a number of states, New York State, New Jersey, Pennsylvania, Delaware, as well as another platform written by developers from Shopify that became COVID Shield, which is now the standard app in Canada. And the point of these being open source is to help the public health authorities, reuse them, leverage them, deploy them with their official branding on it, the official app of Canada, official app of Ireland, but share as much common code as possible. And since that point, we've expanded to provide a lot of additional services around exposure notification and software, and help public health authorities and really the public understand how these work. But there is also lingering in the background other use cases, other ways in which collaborating on common open source software might help in the fight for public health, and in the fight we realized really not just against this pandemic, but help build capacity in the public health authorities of the world around using technology to fight future pandemics, right? And along these lines, another set of use cases that emerged were in the field of trying to digitize vaccination records and use this new field of verifiable credentials. Sometimes it's called a self-sovereign ID or user-centric ID, as a way to help digitize a lot of processes that were today very paper-based, like your paper yellow card that you get from the WHO showing the vaccinations you've received so you can get a visa to travel somewhere. So in December, we decided to onboard a community of volunteer technologists and startup companies and others who'd been working together on a set of use cases, and a model for how governance would work in such a system. They were called the COVID Creds Initiative, and we'll talk more about them later. But now this is really our second major field of activity, of deployment. And once, just like with the first, we're out there working with public health authorities to help them understand the privacy issues, figure out where to plant a flag in the ground in terms of the right approach, just like we did with GAIN. And we have our eyes open for some other domains as well. But really, this is the big picture for LFPH, is really how to meet the needs of the public health authorities through open source software and do capacity building and collaborate with the private sector as well to make that happen.
Okay, great. That there's a lot there, right? So so in terms of and that's where LFPH is. So let's look a little bit about how people got involved and why they get involved. So maybe talk about public health authorities and what are the challenges. So Patrick, what are the challenges that you've seen historically for public health authorities? And then maybe we can talk a little bit about how LFPH can help that.
Sure. Yeah. So I joined the Ministry of Health back in April at the start of the pandemic response in New Zealand, and or a little bit after the start. And the main kind of problem that we were trying to solve, there was sort of two of them. There was a technology problem and a people and policy problem. And the technology problems were largely related to how can we even make contact tracing go faster? What are the main reasons that make that slow? And for us in New Zealand, funnily enough, one of the simplest things was actually just having up-to-date contact details for everybody. We've got a national register of contact details, but at the time, up to 70% of that information was right, but up to 30% of it wasn't. And the challenge was we didn't know which 30% was out of date and which was. So that left us in a situation where we needed to try and convince a whole lot of people to download an app, potentially to give us their details, but no great hook. It's hard to get on the news and tell someone to download an app and give you your phone number. And so the other problem we were also trying to solve at the same time was, obviously when you test positive for COVID-19, you get in New Zealand, you get called up and asked to recount the last 14 days of where you've been. And that's quite hard, particularly for people who have just found out that they've got a disease that could be quite detrimental to their health. So helping people remember where they've been and who they've been in touch with was also a key problem we were trying to solve. And we didn't really, compounding that problem was also the fact that as a ministry within New Zealand, we'd never really delivered direct-to-consumer services before. We hadn't built digital services, digital apps, technology, any of that kind of thing before. We didn't know how to do that well. Historically, we were a policy shop. So that was something that we saw both as an opportunity and a challenge. How do we get out quickly to the public, and how do we help them provide us with information that supports the pandemic response while also maintaining privacy and making sure that people have a good trust within the system. And that sort of leads on to the second sort of set of challenges we had around how do we make sure that people trust the response? How do we make sure they have confidence in the response and what we're doing and why we're doing it? It's no good building an application or a set of services or even developing any kind of thing if anyone doesn't understand it or doesn't trust it, because there's no point building all that stuff and then nobody uses it, because then there's no point building it in the first place. So we worked quite closely with the other government departments that were working on this to try and make sure that our response from a technology perspective was coordinated with the response that they were doing from a marketing and communications perspective. And we learned a lot of what to do and what not to do. But thankfully now, I think we're quite lucky. I know we had a summer holidays just now where we had festivals with 20,000 people all collected together. And I'm quite privileged to be in a position that I'm in at the moment where New Zealand is largely functioning in pre-pandemic times, which is great. So yeah, I think that sort of summarizes where we were at.
Yeah, and I think we all know New Zealand's an amazing, amazing story, right? And a lot of jealousy, I'm sure, about. We all love to be going out to festivals, so that is a truly amazing thing, right? So and let's look also at Tencent, right? So in terms of the provider for health and all the great things, I know that Tencent Health. Maybe people don't know what Tencent Health is doing, right? So maybe you could talk a little about the challenges that you saw, Alex, in this area.
Well, so in addition to everything that Patrick mentioned, right, I think right at the outset is how to actually get the information out to the population in a trustworthy manner. How to actually fight against the infodemics that we're already seeing right at the beginning in terms of just numbers. So that was actually the first thing that we were supporting a lot of the public health agencies on. Now at the end, I think the world gravitated towards the Johns Hopkins dashboard, right, which I think is the right thing to do, so that everybody has a centralized place on data they can trust, with Hopkins's backing. But if we fast forward to what we'll be doing now, right now we are actually busy on how to actually create linkages to systems so that they can get vaccinated. Now, I mean, you talked about, and Brian talked about the COVID credential initiative on how we can actually create a vaccine passport, right? But I think first and foremost is that you need to actually get the message out to the people to get vaccinated. And how do you actually be able to coordinate the different strata of people, different people at risks? First, in the end, the elderly, then different age groups, right? Now, I think this is exactly the case what Patrick mentioned, right? Most public health agencies in most countries are policy shops. They do not have on-the-ground delivery organizations. Now, in countries in Asia Pacific, especially if a lot of the health system have been privatized or there's a significant private involvement, the coordination of that is even more challenging, because then there's actually a public health system and a private health system divide. Now, if I would say that, right, I think the less developed country economically are probably would be able to handle this a lot better than the higher income country, because they are so used to running public health and vaccination campaigns. They are very well used to different types of tools that's required, whether it's actually paper or half digital tools, right? So I think this is where I think the flip side is true. While we have so many of these technologies out there, sometimes if you actually want to get things moving very, very quickly, people may actually gravitate towards the most traditional format. But I think here's where the opportunity for LFPH is. A lot of people didn't actually want to adopt a digital solution because one, they often see the need to actually develop them from the ground up to suit their own specific situation that they need. But right now, I think the whole world is looking at one very, very common need. And I think secondly is a lot of countries just do not have the technical bench strength within their own country to actually develop the software, develop the code. And I think this is where I'm incredibly excited to be part of LFPH. I think this open source movement on simple things where there's actually the vaccine credentials or vaccination registry, right, in the back end, right, could be tremendously helpful to a lot of countries. And I think just given the open source movement, right, and we've seen it with Patrick in New Zealand, is that, well, you start off with a code base, but as each country develop their use cases and develop their new functionalities, right? I can guarantee you that you throw it out there, there will be other people who say that, well, this is 80% of what I wanted. I don't need to reinvent the wheel. And I think this is where, I think this is why we're sitting down here, because we are all seeing the same issues being portrayed or being described differently in each and every different country or setting that we work in. And I think this is a really powerful force that we can actually come together, right, to actually get this going. And to me, as a former clinician, where I'm so used to working at very, very silo system with zero interoperability, just the thought of imagining that, well, could the world or a significant part of the world in a region where there's actually even one simple tool that is interoperable, right? To allow travel, to allow exchange of data in a privacy preserving manner, right? That vision, to me, I still sometimes need to sort of hit myself right now. It's not gonna come true. The doctors and the ones who come out and block this, right? But I mean, I'm a forever optimist. Hopefully this will be the start of something beautiful for public health.
Okay, I'd like the start of something beautiful. I think it's already something beautiful already, right? We're started, but you're right. So maybe I could maybe put that to Patrick. So how do you see like open source and something like LFPH helping, public health authorities? Is open source important? Is it something that's new, or?
I mean, it's certainly important, and I think part of the key driver for us adopting the COVID Green platform was to accelerate the plans that we already had. And to Alex's point, we've got a thriving tech industry in New Zealand. We've got a good cohort of people who can write us some really fancy things, but ultimately there's a lot of engineers around the world who are doing great stuff, and we don't need to spend our energy and our effort reinventing wheels that have already been invented. And so the ability for us to be able to solve our problems with open source technology, and then also contribute back some of our issues that we've had, or fixes to some of the problems that we've had, or new functionality and things that we've developed, I think is incredibly important. It's something that's quite new for the Ministry of Health. Obviously, before, as we said, they don't really have a technology presence as such, or at least outward public facing. We created a GitHub account during the development of this process. So, that was kind of where we were. But now, we've got a lot of buy-in for that. We've got more projects coming up in the future, and we're now considering how open source plays a role within all of the work that we do. And that aligns with the New Zealand government standards. There's a bunch of standards that we already have around the use of open source and contributing back to communities, because obviously technology developed by a government is paid for with public money, so it should be open source where possible, obviously. And so those are the kind of things where I was incredibly privileged to be part of a team that led the charge on this, that meant that we can point to our developments with COVID Tracer as an example of a successful open source project. And that's been really beneficial for us. And I'm optimistic, as Alex is, that this can serve as a good example for how to do this stuff in the future, not just for us, but also for other government departments as well.
That's great. Actually, Brian, do you want to, as an open source, person that we all know well, do you want to say something about why open source, you think open source is useful here, or?
Yeah, I mean, it's funny, having swum in these waters for 25 years, you almost take it for granted that people realize that, 90% of the average software stack that's sitting in everything from, Android phones to a lot of cars these days to big server end systems is open source. You kind of almost take it for granted now that the cloud was kind of built on this stuff, right? What I do think is novel, and what does vary quite a bit out there, is the degree to which public health authorities even have technology teams versus outsourcing that entirely to consultants or trying to buy software products off the shelf, those sorts of things. Some of them are very far ahead in that, and those that are, like New Zealand's, Ireland's is also very far ahead, Canada's as well. They know how to consume it, they know how to pull it in, they know how to hire expertise if they need that, or even pay somebody for support if they'd like to do that. But they've also internalized the fact that they can trust this if they see it's associated with an important organization or and then competently run, has an adequate governance model, adequate license model, those sorts of things. But there's a broader set of needs. I think really, in some ways, New Zealand is an outlier in so many ways. Canada, of course, and Ireland, and really, we want to meet the broad set of needs, and that means being able to engage the public health authorities directly as technologists in the case of some, but also mediated through a set of technology partners that governments are used to working with, right? Whether it's the big consulting companies, whether it's small, scrappy startups responding to RFPs, those sorts of things. We know that a lot of the hard work of actually deploying this, and really this is really important, getting it integrated, exposure notification, getting that integrated with contact tracing systems so that the full cycle of, somebody getting a positive test result to their contacts being notified, like that whole thing is as rapid and agile as possible. That really requires a deeper set of integration that there's nothing we could do from the open source community side to make that more successful than just making sure that there's a large number of organizations, companies really out there that can understand how to work with these technologies. And so that's what we're trying to play here. And also, neither Jenny or I are writing this code. Actually, Jenny might be writing some of it, but I'm not touching it. That's really good. We are really depending upon the community of technologists out there to help build the software, and that's another reason why we really need a really a multi-stakeholder approach to this.
Okay, so let's switch to what we've done, right? The solutions that have already happened. We've already got this exposure notification, and I think we're looking forward to vaccine credentials. So maybe we should start looking at exposure notification. So Jenny, maybe you can tell us a little bit about what is exposure notification, where we are, and the great things I think we've achieved so far.
Yeah, exposure notifications really started being a discussion amongst a number of open source communities back in, it really took off in March, where there was this whole idea back then of, could we do contact tracing but on a phone and have it be totally automated? And the discovery was that you can't actually take all of what you do with contact tracing and just transfer that into a digital experience, because there's so many additional pieces and layers to that actual piece. But what we did realize that we could start doing was something called exposure notification, which is just simply having two phones that are in proximity of each other log the fact that they were nearby. And then if later on, one of the people who owns one of those phones tests positive, they upload their key and notify the other person that that person may have also been exposed to COVID-19. And we discovered that using Bluetooth technology, it was really ingenious. This allowed us to have these notifications go out in a completely privacy preserving way, where all of the data is held on the user's phone. There's no centralized database. There's no way to track people. There's no location data involved. And with all of those assurances, you can still make sure that once that code gets uploaded, that other people can get notified of their exposure risk. And so it's been a really fantastic technology in that sense. I think that it's remarkable the speed at which exposure notifications got together. And I think that's another testament to the power of open source. We had such a big community all working on this one problem together. And so we had the exposure notifications. As I said, we started in March. The first app was launched using the Google Apple exposure notification. Well, the very first app was Singapore's, which was open sourced, I believe, in April and live at that point. We then had others following on with this decentralized model and being privacy preserving using the Apple Google exposure notification system in May. And we had, I don't know how many hundreds of millions of people now can access exposure notification on their phones across the world, but it really has proliferated. It's on every continent except Antarctica, being used by millions and millions of people, perhaps billions. And so much of it is with these privacy preserving aspects. And one of the exciting things has been getting involved with this at LFPH. So we've hosted a number of events that have gotten the community together. We've developed relationships with public health authorities around the world to help them figure out how to navigate this space. For many of them, it's their first time participating in an open source project. And so they're coming to LFPH and saying, how do I do this? How can I know that this software is trustworthy, that it's safe? We've provided things like security audits to show that this is really something that you can launch these apps in your countries, and that you're actually going to be treating your citizens well. Connecting them with vendors, best practices in terms of rollout, all of these different pieces that, because open source software, it's a lot more than just sort of downloading the code and pressing go. There's all of these other elements to it. And so we've really been able to provide that for, at this point, I think it's 26, 27 different countries across the globe. And that's just been a total delight here at LFPH.
Yeah, it's been an amazing story so far, right? So millions of people are actually, and it's a testament to open source that we can get it up and running so quickly, right? So, and thanks Jenny and everyone who's done that, right, so far. An amazing story. So I think also we have, Patrick here, somebody who's using that open source technology as an end user. So maybe you can talk about how you've taken that technology and how you use that open source, and I believe you also contributed back, which is, Wonderful.
Yeah, sure. So I mean, yeah, so we in New Zealand we started with a native application focusing on a digital diary, so helping a user kind of remember where they've been. And we were in touch with Apple and Google around the time that they announced the exposure notifications framework, but we didn't really start seriously looking at unpacking it and starting to use the tech until sort of around July, August. And at that point, I was looking around. I saw the success that the Irish had with their deployment of COVID tracker. And saw the open source spin-off of that with COVID Green, and saw Jenny's name on a thing and thought, right, I'll get in touch. So I messaged Jenny and said, hey, what's all this about? What can we do? And she very graciously invited us to join the Implementers Forum on Slack, which was an amazing wealth of information, and really helped us understand and connect us with other people who were using the tech, as well as how they worked. One thing I think Brian mentioned earlier, the technology itself is just one piece, but how do you integrate that end to end with a contact tracing process, particularly one where it's very human driven, it's very clinically led. You can't just ram a piece of tech in there and hope it solves the problem. It's not going to, and you can't do that at the last minute, flying by the seat of your pants as you are with everything else. So for us, we joined that forum. We learned a lot from what others were doing. We got connected with the folks in Ireland and the team at Nearform who did the development on COVID Green, and a bunch of others who were working on it, which was really helpful. And that allowed us to start building out proof of concept work to integrate with our internal technology and sort of pilot our assumptions and test our assumptions on how it worked, which was, again, really helpful. And then by the time we got ready for our public launch, so our app with exposure notifications went live in early December, we'd had lots of engagement with not only the folks at LFPH, but also other international jurisdictions running the technology, so that we understood it well enough. Obviously, the context in New Zealand was quite different. I think many of the meetings we went to, we were probably the only ones deploying it in an environment where there was no community transmission, which seemed a little bit counterproductive at times. But it meant that we were asking questions of the system that hadn't been asked before, which was also really helpful because we got to learn more about the edge cases of the system, and particularly how well it functions in really light usage, which is good. Up until 2 weeks ago, we hadn't actually even used it, but we had our first community case since November come out just 2 weeks ago, or a week ago. So we managed to get our first use of the system, which was both a blessing and a curse. I was excited to be able to use it, but also it was a shame that we had to use it. So yeah, that was really interesting. So yeah, for us, we've got now a React Native based application using the plugin that Nearform has developed. So the application that we've got itself is not actually the COVID Green app, but we use the plugin that bridges to the native APIs, and all the backend infrastructure is based on COVID Green. So all of that's been really helpful to get us out the door faster and build off all of the expertise and knowledge that's been developed around the world. As Brian said, the COVID Green code base has kind of become the de facto, which is really cool. And then yeah, we've identified a couple of issues in our production deployment. I think we're also able to spend a bit more time actually looking at how it works, and so we've been able to identify a few things that we can fix up, and we've contributed those back upstream. Got another one of those coming soon, hopefully. And then yeah, so it's been a really good experience for us. It's also meant that we can use this as an example for what it means to participate in an open source community like this and to drive value, which has been really good.
And some of the things that really excite me about that, Patrick, and what's been great about working with you, right? One is that having that base to start with has made implementing this technology so much less expensive for your team. And so I think, that's one of the things that that I'm hearing from public health authorities around the world is using this open source software. It's costing them actually a fair bit less than it would to do some sort of custom or private implementation, because there's so much that's already there and already built. And then the other thing is that a number of the jurisdictions I've talked to are really excited to be getting your contributions back, right? And because they can now go and deploy those. And so it's really this global collaboration that we're seeing that I think is just one of the pieces that makes this so energizing.
No, that's great.
Yeah, definitely.
I think that's a great point. And I think we always said in open source, a win in one country is a win in every country, right? So it's a community thing. We all win together, right? In this open source. So, and thank you, Patrick, for I think contributing back is vitally important. And it's great that you're doing that. So now we've talked about, and I think that has been an amazing success story, but we're not going to dwell too much on that now. Let's look at that, I think, which is the subject of that everyone is looking now is around vaccines, right? And vaccine credentials. So that is the next big thing. I think we all know we need to have vaccines. So, and we need to be able to have some credentials. So maybe Jenny, you can give us a little bit of an overview of what vaccine credentials are and maybe why and how.
Yeah, and I'm going to try to, let's see if I can.
I'm going to get you a slide, mate.
Share my screen. Here we go. Excellent. So yeah, vaccine credentials, the best way to really think about it is, and I've borrowed these slides from our partner organization, the COVID Credentials Initiative, which joined LFPH just recently this December. And so the best way to think about this is comparing, if you go and get a vaccination nowadays, most countries at this point are issuing you some sort of paper card to say that you've been vaccinated. And so you go, you get your shot, you get your card, you're told, don't lose this card, make sure that you've got all your data on it, make sure it's signed correctly, and that the doctor has stamped it accordingly so it's official. And then, in the future, right, we're all expecting that there may be situations where we need to prove that we've been vaccinated before being able to enter a certain location or participate in a certain event. And so you get there, you present this paper card, you present your ID with it, whether it's a driver's license or some other form of ID. The security is going to look at these two and say, yeah, looks like the names match. I guess this is good, please come in. And there's all sorts of issues with that particular situation. One, so what if you lose that card? What if you are like me and your toddler spills something all over it, because that's life with small children. What if you were at the doctor's office and you said, hey, can I get a second card? And you give that one to a friend who then writes their name in on it. There's all sorts of different things that can happen that make these paper cards not very reliable. Never mind the fact that when you're having to give an official ID over and this card has information about when you got the vaccine and all sorts of additional details that aren't actually relevant, as well as your driver's license or whatever form of identification you're using. So it's really not particularly good for preserving privacy. It's not particularly good for proving vaccination. It's a pretty mediocre system all told. So what we're looking at with verifiable credentials is it's a really cool technology. So it's based on this idea that you control your data, that the data is on your phone, it's on your device, and it's not centralized. And just like as you go to if you present your driver's license to get into a bar nowadays, or any other venue, the government doesn't know that you entered the bar. With a verifiable credential done correctly, you end up with this exact same situation. So it's a really great technology like that, because what it is, it's a very similar flow, right? You go to the clinic, you get your shot. The provider there has a mechanism by which they can actually give you a credential onto your phone. And then you can present this credential wherever you go. And it's essentially a QR code that's going to get scanned. So it's going to more or less it's not going to have all of that additional information, and you have a lot more control over it, right? You get to decide, you get a lot more control about whether your name is on the credential, how it and done correctly. These credentials will verify that you are actually the owner of that phone and the person with that credential in a digitally secure way. So all of these pieces together just mean that you've got now a digital ID that is very hard to forge, that is attached to you, that you can't lose, that you can't screw up. And so it's really elegantly done in all of that fashion. And so the verifiable credentials is just it's a great way to do, whether it's a vaccination result or a vaccination status or a test result. We're really starting right now by looking at the different ways of presenting COVID credentials. And we see great potential though for this in healthcare moving forward as well, to just put much more control over the way that our health data is handled into the hands of us as people, as opposed to the hands of governments or healthcare systems. So that's COVID credentials and vaccination credentials in just a few minutes. And pardon me. If you do want to learn more about this, we'll put it in the links or in the chat. We had a whole webinar on this last week, and there's a video available, and you can go far deeper into it than I just went.
Yeah, that's a great 101, as they say, right? Thank you. Vaccine credentials 101. So I think so it is vital. So maybe Alex, you can talk as an Asia, looking across Asia Pacific. What do you think about vaccine credentials and how important they are? And what's your perspective on vaccine credentials?
Well, I think for Asia Pacific, its importance is actually very different from any other country if you look at the Americas or the Europe or Africa. Partly because Asia Pacific countries in general has taken the quarantine approach to controlling the pandemic right across the region. And I think this is one of the area where in order to actually fully open up the borders, some form of credential will be required. And I think the interoperability across the countries in this region is actually even more important than others. For that reason. Now, there are US and other groups that are developing their own solutions. And even in China, within the domestic China, the mainland China, there's already the 3-color health codes, right? Those work fine, but they do not necessarily work well beyond its borders. Now, but having said that, I think coming together with an interoperable, mutually recognized vaccine credential is important, but we also need to actually fully understand the limitations of it. I think Patrick said at the beginning, there's the technical side and then there's the policy and people side. It can only verify that whether you have been vaccinated correctly, right, with a certain vaccine. Now, what it won't have is what if a vaccine that has been approved in one country that's being used is actually not recognized or approved by another country, then what do? That's a policy issue. And most of the vaccine right now only has data to show that it protects you from severe disease, not infection and not transmission. Now, when we take a lockdown approach, we are basically saying, well, not even one drop of virus can come into the country. But when you have been vaccinated, you can still have that very low theoretical chance, right? Then what do you do? How do you actually change the policy? So I think while it is important for the technical side, I think majority of the folks here will be involved on the technical side. It's important for us to come to a common understanding and be able to work on this together. I think this is also important for each of us to start engaging on the policy and the policy developer and the regulators on what it means should and if you have such a tool available, and understanding the limitation of the digital tool right at the beginning, right? Rather than thinking that this will be the solution that everybody's looking at, because I don't think that is actually helpful towards the true adoption of what I believe is such a valuable tool in this region.
Okay, so yeah, excellent. So so now we know how important it is. So so maybe Brian, you can talk to the strategy, right? Because I know it was alluded to CCI and the thing. So you thought about strategy of LFPH around the vaccine credentials.
Yep. Yeah, so this is a concept that's been emerging in the technology field. Some of it actually came from the blockchain industry, like the right technology infrastructure for supporting these verifiable credentials. Verifiable credentials as a format is now standardized by the W3C, so that's an international standard, but the trust framework for that is something that is very important to get right. You want to make it possible for somebody to get a vaccination in the United States, board a plane to fly to New Zealand, land, be able to, in Auckland, be able to go to a concert and have all the different hops involved in that chain of trust, able to trust a common vaccination record, right? And without anybody being notified notified that I was presenting this credential without, that doesn't need to be, if that makes sense. And so the technology pieces are coming to play, the trust model is coming to play. What we've started with CCI, well, with CCI, to be honest, started even before we got involved back in March of last year, and now as part of LFPH, is helping people understand the model, helping them understand the technology options out there, just like we did in the early days of exposure notification. That will now be transitioning to also adding a couple of software packages that are designed to be the software behind the wallets that hold these credentials. And by the way, I should mention they're intended to cover test results as well. Vaccination records are kind of an easy starting point, but it's very important, I think, that we also track test results and also, you know, which tests, especially as the virus mutates and that sort of thing. So now we'll be positioning to having some software packages. We're in conversations with quite a few projects now. If any of you know of any or are starting any in this space, we'd be eager to talk about that and see if we could have the same impact here in terms of coming up with some reusable, some rebrandable libraries for holding credentials, issuing credentials, verifying these credentials, and also weaving that into the public health authorities systems, such as the immunization registries and the devices that might be running at the clinics where the vaccinations are being distributed and that sort of thing.
Okay, thanks. And Patrick, you know, so from a public health authority, I just thought it's called PHAs, public health authorities perspective, what do you think around this area, and where are we? Of course, you're in New Zealand, so you know maybe you need vaccines credentials.
Yes, we do.
No.
Yes, we absolutely do. So yeah, I mean, this is something that I've certainly found it very interesting being a fly on the wall in the vaccines chat in the Slack community for LFPH. There's a lot of different opportunities to solve this problem. I think there's a lot of energy going into the vaccine program in New Zealand, and I'm not deeply involved in that. I'm only on the periphery, but I know that there are certainly some interesting questions. The interesting thing around the vaccine credentials and the identity requirements for that is it does tend to go a little bit against some of the goals of a public health authority, where we don't actually want to have someone prove who they are before they can get a jab in their arm. Our goal is to get a jab in as many people as we want and as we can, and we don't want necessarily to turn people away because they don't have a driver's license or they don't have a way to prove who they are. And so that's where, and additional to that, we don't, and domestically at least, necessarily want to stop people going places if they haven't been vaccinated, because that's freedom of movement is a really important tenet of our COVID response, and we don't want to stop people from being able to do the things that they want to do just because they've chosen not to get a vaccine. And so part of the interesting questions for us, I'm sure there'll be a technical solution for this. I'm sure there'll be ways for us to do this, and I'm actually most interested at the moment in how does that technology interlace with society, and how does that work? And for us, as Brian alluded to, so that we can welcome you all here to come to our summer festivals, how do we recognize the right, the vaccines that are being administered are the right ones that we would trust and we would recognize, and how do we do that in a way that's interoperable? And I don't see a future for every country to implement their own vaccine credentialing system. That doesn't make sense. But it's also quite interesting to see of all the different ways that this could happen, who's going to win? And if there's multiple things that win, they've got to interoperate with each other as well. So from a PHA perspective, I can say, we're keeping a watching guard on this, on the developments of this. We're participating in it as much as we can, but we're waiting to see, just quite what shakes out. There's a lot of movement in this space at the moment. So, and it'll be interesting to see where it goes.
There's a question in the Q&A that I think is specifically to kind of the strategy. I'd love to jump ahead and just try to answer. It's from Will Green. Is that all right, Julian?
Yeah. Absolutely.
Okay. So Will asks, how will these efforts dovetail with some of the other high-profile initiatives for verifiable credentials, such as Common Pass and IATA Pass? We are in heavy contact with many of these kind of sister efforts. There's another one being run by MITRE called the Vaccine Credentials Initiative. There are a couple of other standards efforts around. So we are trying to figure out how to basically carve out different parts of the problem and draw our own communities together to build different things. We're one of the only really communities though that are focused out there on writing software in common and converging around common source code and working with the private sector to get that deployed. Lots of other groups are talking with the PHAs and also other government authorities. So we just want to figure out how to bring the community that we've built along and really use the leverage that we get from understanding how software works. In specific, with IATA, they have a project called AOK-Pass, I believe it's called, which is the pilot for that is being built by a company called Evernym, which has been part of CCI from the very beginning. So they're using technology that's very much in the right direction. Common Pass, we've also been in pretty heavy contact with since it actually got started. They're focused very narrowly on getting from one airport to another. And we think that's an important thing to look at, but you need to be thinking about the full spectrum of use cases when you start to realize the privacy implications. Because you crossing a border, there might not be much expectation of privacy in that. Everybody gets notified when you step into a country. But if you go to a concert or a liquor store or something, that's where privacy rights start to become much more front center for people. So we want to make sure that we're building something that actually can meet that spectrum and do that in collaboration with lots of different governments, different levels. So talking with Common Pass quite a bit and figuring out how to weave what they're building into a unified picture.
So yeah, so I think we're talking about how do people get involved, right? So maybe we can go a quick round about people, how this is open source after all. It's not just us, it's a big community out there. So how do people get involved? And I think you don't have to be a technologist, you don't have to be, you can be from anywhere, right? And you can contribute. So maybe I do a quick round, Robin, maybe Jenny. So how would you, if you somebody in this audience or somebody they knew, somebody knew somebody, how would they get involved?
There's a whole bunch of great ways to do that. You can start by joining our Slack, by signing up for a newsletter on our website. Those are the easiest ways. If you want to start talking about how to get involved with some of the projects, I guess joining our Slack is the best way to start there, and asking questions and getting involved. Message me. Love to chat.
And I think we have some things just for public health authorities as well. We have that kind of arrangement. So I think maybe you can talk to how does a public health authority get involved?
Yeah, so a lot of public health authorities want to have a space where they can ask questions and not worry about something perhaps slipping out to the media about whatever they're investigating. And so we do also have private channels available for public health authorities to ask those questions and have discussions with a little bit more protection.
Okay, anybody else want to talk about how to get involved? No, so I think we just need to be involved. I think and please do contact anybody of us, right? It is everybody is welcome, right? And particularly in Asia Pacific, I find people, sometimes reticent to get involved, but please do come and get involved. There's great value that you will get back from it, right? So I'm now going to go a quick lightning question around. So we've covered, exposure notification, which is working and out there, and New Zealand's only had to use it once, but everywhere else is using it quite a lot. And then we have vaccine credentials, which we all need. I want one. So and we all need that for the world, I think, to get moving around. But looking forward, what comes next? So in terms of pandemic or LFPH, what do you think is the next thing that we could potentially be looking at? And I think I'm going to start with Alex on that one. We'll do it alphabetically.
Great. Well, I think what comes next is once we're done with pandemic, we'll go back to the old boring public health topic of public health education, prevention, and chronic disease management. We will still have diabetes and hypertension to look after. And I think this is just a movement for people to get used to it. I think having everything that we've talked about being used, right? It is an education process and educating the population, right, about digitally enabled healthcare. And that will actually make me as a physician or as a public health specialist or as hitting a tech giant in healthcare, right, our job much easier, right, when the whole world's being forced to actually understand what COVID is, what digital ID is. But then I think that's what will be next, and that will continue forever and ever in terms of the boring parts of public health. But I think that's incredibly important once we're done with COVID.
Okay. Brian, you're the B.
Right. Well, I think some of the more immediately adjacent spaces to the two that we've taken are things that have to do with analytics, helping understand, look, there's a lot of challenges now, even just managing the data still at this late stage of the pandemic, especially when it comes to, understanding across the whole of the United States, the whole of a region, what testing looks like, what availability of vaccine looks like, what hospitalization rates and available ICU beds looks like, those sorts of things. So I think data analytics and understanding public health analytics is an interesting domain. And then I think even in contact tracing, there's some more that might be possible there to try to harmonize some of how contact tracing, behind the scenes, behind the app works. And a lot of the frame for this, just as Alex said, is recognizing that public health has been a thing that's been under-resourced for a long time, and that does not end when just this pandemic ends. But even particular to this, I mean, unless we were to succeed in eradication, unless this were to go to the way of polio and smallpox and that sort of thing, we will have to live with mutations. We will have to live with impacts on health from people who do catch it, and there's going to be a need to continue to try to tamp this down and keep the next pandemic from happening. And I think that's an important role for us to play with our software.
Okay, thanks. And Patrick?
Yeah, I mean, for us, this has been a really good opportunity to see how digital services and consumer-led digital services can really help provide better health outcomes. And so for New Zealand, I saw someone commented earlier about Estonia, and what I'm assuming they're referencing is the X-Road, and the way that having consumers owning their health information and being able to be a first party in their healthcare is a really important step. So for us, regardless of the pandemic, this was a thing that we were looking at doing. If anything, the pandemic's kind of accelerated those plans, which is really good. So we'll be looking at all sorts of ways that digital services can help provide health consumers with better access to their health data, and ultimately have better service.
Okay, thanks. And Jenny?
I think what's next is I think that we're going to see a lot more stuff popping up in infrastructure. I think that there's a lot of different healthcare, public health applications out there, and none of them talk to each other. And so we're going to see a big effort coming in of different, trying to get different systems able to interoperate and communicate in a smoother fashion.
Okay, excellent. So thank you, everybody. Thank you, Alex. Thank you, Patrick, Brian, and Jenny for this great conversation. Thank you, everybody out there for listening. We have lots of comments, actually more comments than questions. So we've got lots of follow-up to happen, and we will follow up with everybody who has contacted us. And everyone, please keep safe and keep well. Take care, everybody. Cheers. Bye.
Cheers. Take care.
Bye.